Greetings. It's a real pleasure for me to be asked to present to all of you around the world, wherever you are, about the call to action for Vein Week. We know about the leading killer worldwide. No, it's not COVID-19. It's fatal pulmonary emboli. These are the #1 preventable cause of death after surgery or hospitalization. Now, when you go into the hospital, you can have complications, but despite the best treatment by the best doctors, sometimes these occur. But there is one that's preventable. The same thing after surgery. After surgery, you can have a leak, a reoperation, infection, the anastomosis can come apart, but you can't prevent those complications. But if you can prevent fatal pulmonary emboli, and the way you prevent fatal pulmonary emboli is to give blood thinners, anticoagulants. Now, who do you give those to? Because if you give blood thinners to surgical patients after surgery, they tend to, they could bleed, and so that's counterintuitive. But what you have to do is you have to know your risk score. You have to know what your risk factors for blood clots are. And here is a simple patient-friendly form that you can download off my website, venusdisease.com. It lists all of the various important risk factors. And if you don't have very many of these, then you don't need prevention after surgery. But if you have a lot of these risk factors, you need anticoagulation after surgery, and it can be life-saving. Now let's turn to COVID-19. COVID-19 is a worldwide infectious nightmare. It is littered with thrombotic complications because the virus pierces the cell like a spear of the lining of the blood vessels, and therefore blood clots can occur all over the body. So if you happen to come down with this infection, it's even more important than ever that you know about your risk of thrombosis and you know about your score. And if you come into the hospital desperately ill, and these wonderful first responders and healthcare workers are trying to save your life, they're not going to sit down and ask you 40 questions about your history and whether your grandmother had a blood clot. So you've got to have that information already in your record, or it'll get missed. And if your score is high, you may not only need anticoagulation during the infection, but far into the post-infectious period, if you're lucky enough to be successfully get over this pandemic and survive. So I would like to ask all of you to please go to my YouTube site, Venous Resource Center, or my website, venusdisease.com. Take your risk assessment. There's also an app, Caprini DVT, that you can take your risk assessment on. Take it to your doctor and get it in your record. And please, you can also follow me on Instagram, Facebook, Twitter, and LinkedIn. So all of you, thank you for listening to this message, and have a wonderful day.